Yen saying to me ma emanya diabetes. Na so your ba wo diabetes that now decide say ubefa your phone. Ehia planning. O planning a year ebeboa aboa oba no. One planning a year nso a etumi de nsonsanso bebree ba. Nti so your ba a wo pese ofa your phone. So what diabetes so ni diabetes so. Fakonya na yen twetwen komo kakra. If me DSMV, na diabetes specialist nurse. Aha, advice bia ye ma wa ha no based on UK guidelines. Ye mo ye tire mu nkan bibia wa ha. Ene yɛka diabetes any pregnancy ho asɛm. So what type 1 and answer type 2 diabetes. Now decide sɛ wobɛfa yɛ phone 6 to 12 months ansa na wafa yɛ phone no. Ɛwɔ sɛ ɔne doctor and a diabetes team. Motena se na mo plane. Mma wo ho kwan ɛnyɛ mo kɛkɛ a wonyɛ planning bia. Ɛsunsunsansoɔ no ɛyɛ huge. Yɛbɛka ho asɛm. Nti wo hia saa planning no. Na yɛdi kan HbA1c. HbA1c makyerɛkyerɛm several times. Sɛ ɛyɛ blood test a calculate your average sugar for the past 2 to 3 months. I was so HbA1c no, 48 millimole per mole or less. Tete no 6.5%. And sana wa fire phone. And no interest say a brosa untimi fire phone, but a brosa na fire phone or rex no a double. Na u HbA1c no dear 86 millimole per mole. Miss men fire phone. I was so used to contraceptives till the sugar level no ebe lower. HbA1c no ɛso sen 48 bebree a ɛkyerɛ sɛ ɛsikyire bebree adɔre ɛwɔ wo mogyam. Na wo achieve HbA1c 48 TV a 3 months ansa na wafa yɛ phone no ɛwɔ sɛ wofa folic acid ɛyɛ tablet. Dose ne yɛ 5 mg. Ɔmo smaller dose ɛno wobɛtumi atɔ on the counter ɛnyɛ no ne yɛka. Wei yɛ prescribed dose 5 mg. Folic acid no bɛbɔ ɔba ne ho ban sɛnea ɛbɛyɛ a ne organs bɛ develop yie. Na yɛfrɛ bibi birth defect sɛ bia ne organ bi na koma mfɔ me yie ne spinal cord amfɔ me yie saa nneɛma no ɛbɛbɔ akora ne ho ban. Yɛnkan ho sɛ ma bebree ebi wɔ hɔ koraa mpo a ɔba no ne organs fɔ me ansa na wo koraa mpo no wayɛ aware sɛ wonyam. Ɛno nti na planning no ɛyɛ very important. Wo start fa folic acid na wobɛfa till 12 week of pregnancy. Also making sure sɛ blood pressure, kidney function ne nyinaa yɛ check ansa na wanyam. And most importantly, I was say okay with diabetes eye screening. We will be our diabetes retinopathy deda. Ebetimi ama na worse. Enye nro nyina na ye safe in pregnancy. Diabetes nro no ubehia review. Enye diabetes nro nko a te say blood pressure ne cholesterol nro. Most of the time omo diabetes na ya omo high cholesterol omo san blood pressure. Enti na e was say wo na no doctor na diabetes team. E kwotena se na mo yes planning no. E was omo review on medication. Na for diabetes die no. Eye metformin any insulin eno ena safe ewo pregnancy enu ni bi betimi aha oba no na duro bia na betimi afa se wonyema na hwe bibie placenta na connected to our corona ema no nutrients ema no oxygen no sa placenta ya produce hormones be to say human placental lactogen any prolactin sa hormones yi any other hormones no eboa ema akora no enyinyi na sa hormones ya ama maame no a wonyem no resistant to insulin eno kyerɛ sɛ insulin no enye adwuma yie sɛnea nka wo sɛ no especially so we do 20 weeks air kona edu saa na pancreas na produce insulin no ebe produce more insulin but ebe dum pempen so bi no na insulin no entimi keep up with the demand eho ena gestational diabetes diabetes a develop through pregnancy no eho ena na hyase efiba na so you be a diabetes the dan so a insulin demand no ebe high esan so be more resistant to insulin. Imagine say placenta no bridge glucose esichira yenye carbohydrate mo no crosses our bridge no easily nti cross placenta no akora ne mu easily barrier bi eni ho insulin na maame no pancreas produce no ana say insulin na all no intumi crosses our bridge no intimi crosses our placenta no nti se sichire ne dɔɔso wo maame ne mu a esichire no be cross placenta no akwakodu akora ne ho. Enti very important say maame no esichire no woni mo gem no controlled. Sanya be ya esichire bebre cross placenta no nkwa akora no ho. Esan say akora no nya esichire bebre a etimi ma akora no gain weight. Na do time I was say maame no wo a. Esan say akora no sonti no ontimi nchem naturally. Obehia say obeye CS nye de yi akora no. Surgery bia keto ani pimple cry yakoye surgery apai no. Etimi the complications bebre ba. Nti so kwa koye cesarean section a etumi de nsonsan so bebre enso bre maame no. Nti so what diabetes that now fire phone and I say what gestational diabetes I was say we siture no testing no often before breakfast. I was so aiming for sugar of less than 5.3 and the better show her 1 hour after we did know, I was always situated less than 7.8. And 2 hours after we did here, I was always situated less than 6.4. I was also making sure say we nya hypos. Hypos is situation of less than 4 millimole per liter. Into we situation I was all keeping within this range. Send be a situation be and cross a placenta no na nko obaneho. Balanced diet and exercise are very important during pregnancy. And kwasha won ho komo nko skip meals. I was so didi ye. And also interested did money per two. Who did ya ma ho and obano debi. And also one ho so. Dietitian bet me amount individualized advice. Be very important so be incorporated dietitian or planning no cramo. And exercise no so interested ko gym 30 minutes of moderate walking. 90 ya wo didi we wako walk aba eboa ema unya safe and healthy pregnancy. And sanomni smoking the immediately say what ya say so person fire phone and our fire phone unsi ho. It's an sanomni smoking ebe increase your risk of miscarriage and stillbirth. Nti Mr. we be our planning for pregnancy and our nyem deda and sanomni smoking the eme ho kra. Doctors need to me recommend they say diabetes are omutimi induce you. That is omutimi start with labor early than naturally nka akora ne beba. It's an omutimi hu say bia akora no ehye oyamucha complications no be higher and our risk no ebe more. During labor no we situ no be checking the frequent labor every 1 hour. Ebi mo require the drip esi omuso. Every 1 hour ni a check it omo sugar ni adjust it drip no. Na so UK ha anasa wo Ghana wo diabetes and gestational diabetes EB na awo kama Mr. ko hospital and we will fee complication be at me bem nti wo diabetes and gestational diabetes no advisable so be wo hospital send ya be ya bibi kosia wo medical team no around you mo betimi a support you ye wonya wo wie na placenta no delivered unsi ye ka say placenta no produce hormones and you more resistant to insulin. Enti so you be a unya gestational diabetes we situation no echo back to normal. And so it puts you more at risk. So when you type 2 diabetes in the future. But so you'll be an hour type 1 and type 2 diabetes did that there. We situation no ever back to normal. Enti insulin demand no less. Enti also making sure say insulin no yateso. And yes, I'll be to me hypo, not just we situation no a bit me drop severely low. Any safe. Hypo so you're very dangerous. Unya gestational diabetes 6 to 13 weeks after giving birth no. I was so sugar checking. And every year I was set or call for HbA1c I was see a check. It's any very situation costra you be detect here. Diabetes and stop it obia from getting pregnant. And so we are watching so before your phone. We here planning. One planning I want to so ma woman no. Ebi ayabobo so no say oba no betimi develop ayekese into be here CS. And our situation so there be higher etimi say when etimi affect your kidneys. Oba no so no ebetimi amanya birth defects. To say you be won no bia ne organs te say na koma na for me if baby spinal bifida ne spine no won say mo anto na bie na say ubenya miscarriage and I say ubenya stillbirth. U plan here we nyina utimi avoid it. Ubetimi anya safe pregnancy wow healthy baby. Inti planning no very important. Na sa wonya ho so ne ka che say gestational diabetes emfe ni agro de wo say we no na esonson so ama so share video ma obi a diabetes or person fire phone and our fire phone na follow for more diabetes tips ebe sensia